name's Kaitlin Fedro, and I am 1 in 5 mothers who experiences a perinatal mood or anxiety disorder during the perinatal period. I first started noticing symptoms of PMADs in myself during my pregnancy. I experienced some medical complications during my pregnancy with my son, and my OBGYN thankfully was very on top of monitoring my mental health and my mood, and helped me find a medication that worked well for me while I was still pregnant. I experienced, as many women do, a very difficult and I would say traumatic labor and delivery experience with my son, resulting in an unplanned C-section. Subsequently also experienced some feeding challenges with him and initiating breastfeeding. And as I know now, as I've learned more about PMADs, all of those things can be risk factors for developing depression, anxiety, or another mental health issue during that postpartum period. I initially thought that I was just experiencing the typical baby blues, but eventually through conversations with my OBGYN, with my husband, with my family, came to realize that I was not coping as well as I thought I was. I had a very difficult time sleeping. I struggled with intrusive thoughts. I found it difficult to bond with my baby, and also found it very difficult to allow anybody to help me with the tasks of new parenthood and taking care of a newborn. I'm very thankful that I had people in my life who helped connect me with resources. I've been seeing a therapist for almost a decade now, and my therapist was so helpful in helping me identify resources that were available to me to help in this unique season of my life. I also had family members and friends who stepped in to help both me and my partner find opportunities to sleep and rest and take care of ourselves. And I also found other resources available for peer support, medication management, and just meeting my physical needs. One of the most important things that I've learned during this experience is that I deserve to be well for me. I used to tell myself that my son deserves to have a mom who is stable and well, that my husband deserves to have a partner and a wife who is stable and well. One of the things I realized for myself is that I deserve for me to be stable and well and to be thriving in parenthood. I am a little over a year out from giving birth to my son, and with a combination of peer support, medication, therapy, and social supports, I find that I'm really hitting my stride in motherhood. Things are still really hard, and I'm still coping with all of the trauma that I experienced during that early postpartum period, but I'm here to tell you that there's hope. If you have any concerns for yourself or a loved one who is experiencing symptoms like what I shared during their pregnancy or during the first year postpartum, we will make sure that there's some resources linked below, and you are also always welcome to contact the Heart of Texas Behavioral Health Network for more information about supports available in the community.